Good afternoon, everyone. Welcome to our LAMP webinar. And for our LAMP foundations, we will continue discussing blood or shui. Functions of blood. Blood provides the material foundation for the mind or the shen. Okay. So blood is considered to be part of yin, and yin is supposed to be dense, fluid-like, and it houses and anchors the mind. And the blood also embraces the mind, providing harbor or residence within which mind can flourish. So if we are deficient in blood, then there can be no residence for the mind. So the mind can become restless. Blood is now considered to be the mind of a person, no? So when blood is harmonized, the mind has a residence. So there is a very, very direct relationship between blood and mind, okay? So we even consider blood as the mind of a person, okay? When blood is harmonized, mind has a residence. If blood is deficient, so if we have a condition called blood deficiency, mind will not have a foundation. So what happens is the patient becomes unhappy or uneasy. So take a look at your tongue. If you have what we call the blood deficiency pattern, then most likely you may not be too happy. Or you may be restless. You might be uneasy, no? And this is manifested by deficient restlessness. So ibig sabihin, or you become restless because you are deficient in blood. So what are the manifestations of deficient restlessness? You'll have vague anxiety. Hindi mo malaman kung bakit ka masyadong anxious, no? Slight irritability, and you are always have this feeling of dissatisfaction. So this is quite interesting because we can actually look at the tongue to be able to find out why some people may be unhappy or uneasy. No, some people may be having vague anxiety, slight irritability, or they are having this feeling of dissatisfaction. When asleep at night, so we all sleep at night, no? The blood will naturally embrace the mind and the ethereal soul. But if you have blood deficiency, if blood is deficient, the mind and ethereal soul will float. And so the person cannot sleep, or the person dreams a lot. Pwede kang matulog, but you always dream. Okay? So try to remember when was the last time you always dream. So probably meron po tayong blood issues. Okay? To nourish the blood, so this is important. I hope we can all learn from this, no? So if you can relate to this, or if you have a loved one who may be suffering from vague anxiety, no, mild irritability, so you might want to use Ren-4, especially in women. Ren-4 kasi is very good for the kidneys. So when we tonify the kidneys, we tonify the yin, no, and the yang. Okay, stomach 36. Okay, that's also a very good point. And also liver 8 and spleen 6, no? So liver 8 is the tonifying point of the liver, no? And it's supposed to be the C point, no? Spleen 6 is San Yin Jiao. So you're actually going to help the 3 channels here, the spleen, liver, and kidney. So again, we use Ren-4, stomach 36, spleen 6, and liver 8. Okay, so if you have someone, or if you have a patient next time who comes in with complaints of insomnia, or probably having a lot of dreams, then you know what to do. Okay. Blood originates from food qi or ku qi in the heart under the influence or agency of the original qi. So ibig sabihin, hindi ka din makapag-form ng blood if you have a weak original qi, or you can form blood but it's not of good quality. No? The kidneys contribute to making blood through the marrow and kidney essence, because we know that the kidneys store the essence. Blood nourishes the body. That's very, very obvious. And it circulates with our yin qi, or the nutritive qi. Kaya when we needle, we're actually affecting the nutritive or the yin qi. So since kasama po ni yin qi si blood, so we can help the patient a lot. Okay. And of course, the blood moistens the body. So if you happen to have blood deficiency, we always look at dryness as a sign. No, it houses the mind, and it determines the mind. Determines menstruation. Okay, sorry about that. So what is the relation of blood with internal organs? Okay, let's start with the heart. The heart governs blood and blood vessels, okay? And it is responsible for its circulation. So you need the heart to pump the blood, where blood is made through the agency of heart fire. Fire is yang. So the heart is where the blood is made. So you have to have heart fire. Kasi kung kulang ka sa fire, wala rin, no? Fire is yang, so it transforms into yin. And blood cools down fire, preventing it from flaring up excessively. So for people who have blood issues, blood deficiency, then magkakaroon ng flare-ups. Fire is yang, and you need the yang to generate blood, no? Which is yin. Ganun lang. So you generate something out of another thing, no? So again, you have to have heart fire so that you can make blood. So because fire is yang, and being yang, it can generate blood. So yang produces yin. Yun. Blood nourishes fire. It makes sure that the fire does not flare up. So blood is very yin. So it seems to actually balance the fire, whilst blood moistens the lower burner. Okay? So blood moistens the lower burner. Blood is stored in the liver. No, it fills the sea of blood, and the penetrating is the Chong meridian, and the directing, which is the Ren, girdle extraordinary vessels, and warms and nourishes the whole body. Okay, andito na si Ma'am Mildred. Ma'am Mildred, would you like to continue? Pasensya
Yes,
na.
no.
Thank you
Pasensya na po kanina.
Alam ko may pasyente ka pa. It's okay. No problem.
Okay po. So magandang araw po muli. Pagpapatuloy po natin yung ating dinidiscuss ni Doc about heart. Blood nourishes fire. Make sure that fire does not flare up. Whilst blood moisten lower burner. Kaya po yung pag-heart natin nagkakaroon ng init. Siya po yung nakikita natin na yung mukha po namumula. Tapos pag tinignan natin yung tongue, yung dulo po ay mapula rin. So yung heart din po ang stored in liver, yung blood. Fills sea of blood and penetrating, directing girdle extraordinary vessels, warm and nourishes whole body. So when blood moisten, lower burner and sea of blood, heart fire follows it down to umbilicus. Then blood is flourishing and fire does not flare excessively, so that men are free of disease and women are fertile. So, heart, essential for formation of blood, has to flow downward to lower burner to interact with blood. Chinese pulse diagnosis confirmed that heart corresponds to blood and lungs to Qi. Since heart is felt on left side and lung on right, left side reflects state of blood, while right pulse indicates state of Qi. Kaya yung pag pinulse po natin pag sa right, blood po yung nalalaman natin yung sitwasyon kung ano. Pag sa left naman ay baliktad pala. Pag left side, yung state of blood, while right pulse, yung ating enerhiya po ang nadidetermine natin ano yung kalagayan. Ayan po makita natin ano. So, yung sa parte pong left, yung heart, liver, and kidney sa baba. Pag sa unahan po ng konti, dito sa may ano ng thumb natin, ang mararamdaman po natin doon yung kapartner ng heart ay small intestine. Tapos yung kabila po ay gallbladder and bladder. So yung mga magkakapartner organ po yan yung zangfu. So pag right naman po, ang makakapa ay sa unahan, lung, spleen, then heart. So pag sa labas pong bahagi, makakapa natin yung large intestine, stomach, and triple burner. So, yung heart po, siya yung governs the blood. And spleen makes blood. Kasi nga yung pag kumain tayo, di ba, ng mga pagkain, ita-digest, at yun yung magiging blood sa tulong ng mga organs. So, ang mag-store po nun ay ang liver. Mag-store ng blood. So, yun po yung relationship ng tatlong organ. So, pag ang spleen naman po, related to blood in two ways. Number 1, origin of blood. Produces food Qi. Basis for formation of blood. Yun nga po yung sinasabi natin mula sa mga pagkain. Yun ang unang role ng spleen. Ida-digest niya. Tapos, yung Spleen-Qi ensure that blood remains in blood vessels and does not extravasate. So, kung mahina po yung Spleen-Qi natin, siya po yung makikita natin na may mga parang mga patsi-patsi po ang tawag ay sa Tagalog. Pasa-pasa, yun. So, ang mga pasyente natin na nakikita natin may pasa-pasa, yun, i-consider na po ninyo yung kalagayan ng spleen. Spleen-Qi ay mahina. So, Spleen-Qi is deficient, Qi cannot hold blood. So, yun na nga po, may hemorrhage. Maaari din po yung mga biglang nagdurugo yung ilong, yung sobrang konting sugat lang, halos hindi natitigilan yung pagdurugo. So, spleen function po na i-hold yung blood ay mahina. So, okay po. Thank you.
Thank you very much, Ma'am Mildred. Mukhang meron kang ano. You have to drink more water siguro.
Oo nga po. Malamig, mainit po dito sa amin, Dok.
Oo, sa amin din. Anyway.
Tapos, natapos na maraming ginawa.
Ay, oo. Baka kulang sa tulog. Any questions from the class? So, Ma'am Mildred will continue with her discussion of blood tomorrow. So, nagiging mas interesting ngayon yung ating understanding of shui or blood. Next, we have tongue diagnosis, and let's call on Ma'am Teresita Sumile from Rizal. Good afternoon po, Ma'am Teresita.
Good afternoon po, Dr. Hector, at sa lahat na po. Now we will talk about welcome po sa tongue diagnosis, and we will talk about the observation of tongue body shape and its significance. Neither swollen nor thin, the same shape all over, flexible but static and has no cracks. Its significance is normal. Thin tongue body shape indicates yin deficiency, blood deficiency, or lack of fluids or dryness. Pale, large, swollen with tooth mark reflects Qi and Yang deficiency or damp phlegm. Normal colors swollen indicates dampness or phlegm. Red swollen indicates stomach and heart heat or damp heat. Purple swollen indicates poisoning, and partly swollen depends on the color and the area. If the sides are swollen, it indicates liver or gallbladder fire if the sides are red, or liver Qi stagnation if the sides are normal colored. Then, if the swollen area is in the middle of the sides or teeth marks, it reflects Spleen-Qi deficiency. If the tip is swollen, it indicates heart, usually phlegm or heat. If the front third is swollen, it indicates lung, usually phlegm, but can also be Qi deficiency. Next is sunken areas. It also depends on the area. So if the sunken area is in the middle, so it indicates stomach and or spleen-Qi deficiency. If the sunken area is on the front, it indicates lung Qi deficiency. And if at the rear, it indicates Kidney-Yin deficiency. Next is quivering. It indicates Yin or spleen-Qi deficiency. Stiff tongue body indicates interior Yin. If the tongue is red, this is due to extreme heat. Okay. Next is flaccid and pale. Indicates spleen and heart Qi and blood deficiency. Flaccid and red indicates heat. Flaccid red and dry indicates Kidney-Yin deficiency. Long tongue body shape indicates heart fire. Short tongue body shape indicates heat or cold. Now, if the tongue is red, it indicates heat, while if the tongue is pale, it indicates cold, okay? Next is swollen veins on the underside of the tongue, indicates Qi and or blood deficiency, blood stagnation. Very flat and pale veins on the underside of the tongue indicates Qi deficiency or blood deficiency. Now let's go to cracks. A short crack in the center, the area is pale and with coating, indicates stomach or spleen-Qi deficiency. A short crack in the center, the area is red and lacks coating, indicates stomach-Yin deficiency. The crack in the middle is deeper or wider than with a sticky yellowish coating, indicates stomach fire or phlegm heat in the stomach. Irregular or transverse cracks in the central part of the tongue indicates stomach-Yin deficiency or stomach and kidney-Yin deficiency. Long crack along the central area with several transverse cracks spreading outwards indicates stomach and kidney-Yin deficiency. Crack all the way down the middle of the tongue and out to the tip indicates constitutional weakness with a tendency to heart imbalances. Two diagonal cracks behind the tongue tip indicates lung Yin deficiency. Short transverse cracks on the sides of the tongue indicates spleen-Qi and Yin deficiency. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. So parang it actually sums up everything na, no? The cracks and the shape.
Oo nga po, Doc. Ang ganda pong tingnan. Kasi dun pa lang ma-determine mo na kung ano talagang disease ng organ.
Importante kasi paulit-ulit, di ba? I'm sure.
Yes po, Doc, para ma-internalize.
And hindi lang paulit-ulit. You have to always see the real tongues, no?
Kaya dapat laging titingnan natin yung tongue din natin.
Kaya magpunta ka na, Ma'am Teresita, sa sa lab.
Yes, Ma'am Tess, para
yun lang po ang problema, Doc. Gusto ko talaga sana, pero naging yaya bells ako dito, Doc. Walang helper ang pamangkin ko, so ako ang nagyaya.
Sige. Sige. Maraming
Sige
salamat
lang, in
po.
God's time, I will go there.
Sige. Okay lang. Okay, sige po. Next, we go to diagnosis by interrogation. It's always good to see Ma'am Vina back from vacation, di ba? Ma'am Vina, welcome back. Straight from Baguio. O, di ba? Healthy na si Ma'am Vina.
Buti pa ka naman, Bina, walang init.
Opo.
Daming tao sa
Ah.
Baguio ngayon.
Opo, Doc. Marami po. Mainit po doon.
Ay, mainit na yun. At least yun.
Opo. Sa beach po. Mainit po.
Wow.
Pero sa Baguio po,
Nag-union
medyo
kayo.
okay lang po naman.
Okay. Okay.
Minsan, Doc, pupuntahan natin si Ma'am Bina.
Oh,
Sabay-sabay
yes,
tayo.
yeah, sure. Hopefully by
Kailan,
June.
kailan natin pupuntahan sa Ma'am Vina?
Oh, pag may medical mission na si Ma'am Vina doon.
Sige, Ma'am Bina, mag-akit ka. Akit kami.
Sige po,
Ma'am Vina,
someday.
may tentative schedule kami sa June 23, 24, and 25.
Saan po?
Hopefully, sa Baguio po. Punta namin si Ma'am Vina.
Okay. Pupunta na ng America si Ma'am Vina that time. Joke.
Kasama ako, Ma'am. Kita tayo.
Ay,
Kasama
20.
namin Ma'am Vina si Ma'am Connie.
Sige
si
po,
Dr.
magpa-acupuncture
Connie
po ako sa
Montal.
inyo.
Sasama daw siya sa amin.
Sige po, magpa-acupuncture ako sa inyo po.
Okay po, si Ma'am Connie, hindi sa akin. Kayo, Ma'am Mildred, pwede tayo makita-kita doon? Ma'am Mildred?
Yes po, dadaling ko yung laser. Takot ka sa karayom eh.
Sige, magpa-acupuncture kami dalawa ni Ma'am Dina.
Sige po.
Okay. It's a date.
Opo. So, magandang hapon po, Doctor. Magandang hapon po sa lahat. Ang topic natin ngayon ay feeling of cold, contradictory feelings of cold and heat in internal conditions po. Contradictory hot and cold feelings are very common, especially in women and especially after 40. Kasi ito po yung 4 na possible causes. A. Simultaneous deficiency of Kidney-Yin and Kidney-Yang. B. Blood deficiency with empty heat. C. Disharmony of the penetrating vessel. At saka letter D po ay Yin Fire. A simultaneous deficiency of Kidney-Yin and Kidney-Yang is very common in women over 40. Indeed, it is probably more the norm than the exemption. Kidney-Yin and Kidney-Yang ay meron pong common root, and especially after 40 years old. A deficiency of one often involves also a deficiency of the other, albeit in different degrees. Thus, when there is a deficiency of both Kidney-Yang and Kidney-Yin with a predominance of the latter, there will be kakaroon po ng nahihilo ang patient, may tinnitus, night sweating, malar flush, yung palm heat po, and a feeling of heat. But possibly also, malamig din ang mga paa. When there is a predominance of Kidney-Yang deficiency, there will be dizziness, backache, tinnitus, frequent urination, a pronounced feeling of cold, and cold feet. But possibly also a feeling of heat in the afternoon. Letter B, blood deficiency may cause some empty heat and therefore contradictory hot and cold symptoms. In fact, blood deficiency may cause, ito po yung sanhi ng malalamig na kamay. But when empty heat arises from it, in chronic cases, there may be a feeling of heat sa mukha naman. Then letter C, disharmony of the penetrating vessel. Contradictory hot and cold symptoms may be caused by a disharmony of the penetrating vessel. Pag yung vessel na ito is deficient, which involves yung kidney deficiency, a deficiency of Qi in its descending branch, ay sanhi po ng pagkakaroon ng malamig na paa and the ascending rebellious Qi. It may cause a feeling of heat sa mukha po. Then letter D, Yin Fire. Finally, Yin Fire may cause a person to feel cold in general at feeling of heat sa mukha. The pathology of Yin Fire has already been explained above. So ito po yung yung summary niya. Contradictory feeling of cold and feeling of heat, simultaneous deficiency of both Kidney-Yin and Kidney-Yang, then blood deficiency with empty heat, and another is disharmony of the penetrating vessel with rebellious Qi, at saka yung last po ay Yin Fire. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. So we're all looking forward to the Baguio trip. O, diba? Excited na sila. 23, 24, 25. Okay. Tingnan natin. Okay. Any questions from the attendees? If there are no questions, tuloy-tuloy tayo sa pulse diagnosis. And let's now listen to Ma'am Mildred na nasa Kalibo ngayon.
Apayaw, Doc.
Apayaw, sorry. Apayaw pala. Medyo malayo-layo na yan. Ha? Nasa north na.
Kadulo, Doc, ng Pilipinas. Katabi namin ang Apari.
Okay.
Natatanaw na po ang Taiwan.
Okay. So, pwede ka lumusong sa Taiwan.
Yes, Doc. Binabangkalan po ng mga taga rito papuntang Taiwan.
So,
Wow.
sakaling may mangyari.
Kapit kaming.
Okay.
Madali lang mapunta sa Taiwan.
Oo, pag may nagpadala dito ng ano ba yung papadalan China?
Okay. Okay. So, Ma'am Mildred will discuss the structure of the pulse. So this is for beginners. Ulit lang po. Good afternoon, po, Ma'am Mildred.
Pulse diagnosis, structure of the pulse. The structure of the pulse, something that can initially create confusion and frustration in the diagnostic relevance, attributed to the depth and position of the pulse position in the various pulse diagnosis texts. The pulse was originally palpated in 9 different locations on the body. The 9 sites were specifically related to the various Zhang organs and to the 3 jiao in general. The pulse was felt in 3 locations in the head and neck, 3 places on the torso, and the 3 places on the legs. These 3 areas of the body in themselves related to the continuum of heaven, man, and the earth. The same was therefore also true of each of these 3 pulse positions in this area of the body. When the pulse was later felt only on the radial artery, this division into 9 positions on each wrist was maintained. As 3 positions in the superficial level, the 3 positions differ down, and the 3 positions in the level between the superficial and deep levels. So yun po, doon natin nakakapa yung mga pulse, iba-ibang part ng body. The pulse can be comprehended as a 2-dimensional structure. On the horizontal plane, there are 3 positions along the length of the artery. Ito po yung tinatawag natin na Kun, Guan, and Qi sa term po ng TCM. The vertical plane has 3 depths. Yung una po ay yung depth, middle, and superficial. So, yung superficial po, pag pinatong mo yung kamay mo, pag medyo diniinan mo, siya po yung middle. Pag mas madiin pa, yung depth. So in reality, it is a 3-dimensional structure because the width of the pulse has also significance. Further, some pulse diagnosis system operate with position lateral to the Kun, Guan, and Qi position. So yung may ibig sabihin po yun yung mga depth na yan. So yung mga una po nating na-discuss na sinasabi natin pag superficial, nasa labas pa lang yung pathogens. Hindi pa nakapasok sa internal organ natin. Yun po yung mga sinasabi, pag middle, ay papasok na. Pag deep, talagang nasa organs na po natin yun, yung pathogens o mga sanhi ng sakit. Some people have a very rigid definition of the pulse position and the relation to the organs or channels. So sa ganito pong approach, ang deep level of pulse relates to the Zhang organ. Yun po yung sinasabi natin, no? Pag nasa deep na, involved na po yung Zhang organs or yung ating mga organo sa loob ng katawan or channels and the superficial level to the Fu organs or channels. So yung superficial level po, yung mga Fu organs. Personally, I prefer more dynamic approach to the pulse with changes in the pulse being seen in the context of changes in the body's qi and how these changes will have affected the pulse. So malalaman po natin yung situation ng ating qi sa pamamagitan ng pulso. Malalaman natin kung mahina yung qi, kung mainit, marami bang init yung katawan, kasi makakapa natin kung fast or slow yung ating pulse. So in most situations, I view the organ pair as an organic whole, the different levels reflecting both organs simultaneously. Example po nito when there is ascendant liver yang. So yung pag tumataas po yung init sa liver, the pulse will manifest with full, wiry, and superficial. So malalaman natin na full, nasa dun sa liver dahil pag kinapa natin po, malakas nating mararamdaman. So karaniwan yung wiry na pumupwesto po yan sa liver organ natin. Then in the left hand side, yung 1 position, ito naman po yung stomach qi. Halimbawa, stomach qi deficiency o stomach qi shu. Shu means deficient. Will often manifest with a relatively deeper, weak pulse in the right 1 position. This is because yang rises upwards and outwards, and therefore the pulse in the left 1 position become denser and more superficial than it otherwise would be. So yung pag qi deficient po, on the other hand, will mean that pulse is weaker. Deficient, kaya mas mahina yung mararamdaman natin. And there is not enough qi to lift the pulse up to the superficial level. So yun, syempre kung mahina, yung energy rin, hindi niya daw mai-lift up yung pulse. Syempre, konti yung pagpitik. Kaya hindi po niya maitaas sa superficial level. Okay, ibig sabihin nun, yung qi ay nasa mas malalim na bahagi na ng katawan yung pathogens. So yung the 3 levels, there are 3 levels of depth in pulse. Ito nga po yung superficial na nararamdaman natin sa pagpatong lang ng ating kamay, very light touch. Tapos being located just below the skin. Yan, pag pinatong mo yung kamay mo, mararamdaman mo na. Yun yung po yung superficial level. The depth level is filled with the exertion or greater pressure by fingers. So pag depth naman po, kailangan mo ng diinan. So hindi naman po, it's not so deep through that you are pressing into the muscle below. So the middle level is located between the superficial and deep level. So nasa pagitan po yung middle level. The different level represent different aspect of the body. So it seems paradoxical of the same level can reflect several aspects simultaneously. So ang importante dito po ay na dapat nating tandaan, yung different levels reflect where qi is or is not in the body. A pulse that is only felt on the deep level, for example, qi will indicate there is yang deficiency, that there is not enough yang to be able to raise the pulse up to the superficial level. So alam naman natin yung yang, siya yung sa ano ng movements. So kung mahina yung yang, hindi natin halos mararamdaman yung pagpitik ng pulso. At the same time, a pulse that is only present in the deep level can also indicate that there is a stagnation of qi. O pwede raw pong may stagnation ang qi or merong lamig sa loob ng katawan. Sa pag-deep level natin naharamdaman. The cold blocking yang qi and thereby preventing yang from lifting the pulse upward. So there will true be significant difference in the qualities of these 2 pulses, even though they are both felt only in the deepest level. So In this instance, the yang shu or yang deficient pulse will be not only deep but also lacking in strength. So pag diniin mo po, bukod sa malalim siya, mahina. Whereas the pulse, when there is a stagnation of cold in the interior, will feel tight and hard. There will also importantly be the differences in the other symptoms and sign of the patient is presenting with. So pantulong po kasi natin yung pulse dun sa tongue. So ano po natin ang mas maganda pag tinitingnan din natin yung tongue kasabay yung pulse. The superficial level of the pulse represent both Qi and Yang, as well as the Yang organs and channels. At the same time, the superficial level can also indicate whether an imbalance is located in exterior, which is the Yang aspect of the body, from an eight principle perspective. Yun. So pag yung pulse po natin, nalalaman natin na nasa exterior pa lang, nakikita din natin yung mga sign and symptom ng pasyente natin, nasa exterior level din ng katawan. Yun. There are only contradiction when you do not see the pulse in a greater context. If there is a tight, superficial pulse and the person freezes and has an aversion to cold, a stiff neck and sore muscles, yung superficial pulse niya po ay nag-indicate ng imbalance is located in the exterior. Kasi yung muscle exterior, ano po yan ng body. Kaya so, ang imbalance pa ay sa exterior pa lang. Tapos superficial nga yung pulse. So this is not contradict the other aspect of the superficial pulse, which is that superficial pulse represent Qi and Yang. When there is an invasion of exterior, it is the Yang Wei Qi that is activated and the struggle takes place in outermost aspect of the body. So, yun po, yung pag nasa exterior pa lang, yung Wei Qi natin, yung Yang aspect niya ang nakikipaglaban. Kaya nararamdaman sa level ng skin, just before the skin. Conversely, a pulse that is only present in the superficial level, but feels thin and weak, could be a sign that there is yin deficiency or blood deficiency. In this case, the yin and the blood, the yin and sui, yung sui po yun yung blood, are no longer capable of anchoring Qi, which therefore drift up to the surface. So yun po, pag mahinang-mahina na, hindi na niya mapanghawakan. According to Ming Dynasty doctor and author Li Jinjian, the condition of the various sang organs can be felt at different levels. So this model sees the three levels as a reflection of the three jiao. Again, this analysis does not in reality contradict the other perception of levels, but it is fact complementary. So magka-complement. The superficial level relates to the heart and the lungs. The lung govern Qi and Wei Qi. Alam naman natin yung gawain po ng langsa, no? Siya ang nag-govern sa Qi. Kaya siya din ang nagdi-distribute sa Wei Qi. This means the exterior imbalance will directly and indirectly affect the lungs through its relation to Wei Qi. So the lungs and the heart have a close relationship with Zong Qi. Naalala pa po natin kung ano yung Zong Qi, combination of air Qi and food Qi. Pag nag-combine po yun, yun yung Zong Qi. Yan. Driving blood or sweat from the heart through the vessels. The middle level reflects the quality of sweat or blood, which sweat is produced by the stomach and spleen. And because the stomach and spleen are both in the middle jiao, their status also affects the pulse of the middle level. Yun po yun. Kaya ando siya sa middle. So yung deepest level naman po ay reflects yin. Example, the yin organs and the yin qi. When an imbalance is in the interior o nasa loob po ng katawan, mararamdaman po natin sa mas malalim na bahagi, deepest level of the pulse. Yun nga, ididiin mo, mas may konting diin. Furthermore, Yin imbalance from an 8th principle perspective will create changes here. When there is yang deficiency, so pag kulang pa yung init ng katawan, the upward momentum of yang will be too weak. O kasi mahina nga yung heat nung ating body eh. So hindi niya ma-push up or pulse up to the superficial level. Kaya alam natin na pag deficient yung yang, mas deep ang pulse. Kidney and liver yin are the deepest level of yin in the body. This means that weakness of kidney and liver yin will felt not just in their respective organ position, but also in the deepest level of the pulse in general. So, yun po yun. So, ang level po, superficial, middle, deep. So, alam na po natin pag pinatong mga kamay mo, yun ang superficial, medyo din ng konti, yun ang middle, mas madiin pa ng konti, yun ang deep. So, yung type of Qi and Yang, as well as Yang organs. Pag superficial, yun po yung nakakapa. So, pag middle, yung blood, pag deep ay yung yin, as well as yin organs. So, pag level po niya ay exterior pa lang, pag nasa exterior, ang makakapa natin yung, pag ganun ba yung level niya? Level, stomach and spleen. Pag middle, blood, siya po yung namamalo sa stomach and spleen. Organs according to Li Jinjin. Diretso po natin basa. So, superficial, Qi and Yang as well as Yang organ. Ang sinasabi nito ay nasa exterior pa lang, ang pathogenic factor. So, according to Li Jinjin, yung Yang na naapektuhan din ito ay possible na maapektuhan ay lung and heart. Yan, superficial kasi ito yung tune. So, sa lung and heart, sa part ng superficial level, yung sa tune, yan po yung magka-partner, left and right yan. Pag middle naman, blood. So, level ng stomach and spleen, yung middle ang ating makakapa. Kasi, ang magka-partner naman dyan ay ang liver and spleen, stomach and spleen. So, pag deep, yin as well as yin organ. So, pag deep na po, yan ang involved ay interior na, interior organ. So, according to Li Jinjin, yun yung yin, liver, and kidney. Liver and kidney. Sa deep. Pahabol ko lang po, pag napag-aralan natin nung last na ating mga topic, nagagamit ang pulse, tanungin muna natin yung pasyente kung may iniinom na gamot kasi nagbabago po yung pulse dahil sa mga iniinom na resetang gamot ng mga doktor. So kung may iniinom po sila, na-discuss natin ano mga klaseng gamot yun nung nakaraan, nakaka-affect po siya sa ng pulse, sa bilis, basta pag nakapa natin nababago ng gamot. So magagamit natin ang pulse kung wala silang mga iniinom na contraindication sa pagbabago ng pintig ng pulso o ng puso. Okay po.
Thank you very much, Ma'am Mildred. That was very, very helpful indeed, no? So, I don't know paano natin maturuan ng pulse, but I think constant repetition, di ba? Hanggang sa mapipilitan na tayo mismo na mag-practice. And,
opo, at least po yung diniscuss natin, Doc, basic yan. Kasi yung yung nakaraan talagang maraming klaseng pulse. Pero yan, basic lang, di ba? Alam mo lang kung nasaan yung position, deep, superficial, middle, and deep. Tapos, pass bato, slow, para lang po mas madali nilang matatandaan. Pag pass heat, pag slow cold, or deficiency. Parang ganun po
Yeah, maraming salamat po, Ma'am Mildred. And I'm sure maraming natutunan yung ating mga attendees. So, from pulse diagnosis, diretso na po tayo sa differential diagnosis, part of TCM Foundations pa din. Let's welcome Ma'am Needs You. I hope her signal is clear sa Tiaong.
Good afternoon po, Doc Hector, and good afternoon, everyone. How's my audio, Doc?
Very clear po. Buti naman.
Medyo maingay doon sa pwesto ko, lumipat ako dito.
Feeling natin na sa Tiaong tayo, di ba?
Dito ako sa Lukban, Doc.
Lukban, sorry.
Medical mission kayo, Ma'am Nits.
Oo. Wellness.
Ay,
okay
wow.
po. Thank you. Our topic for today in our TCM Foundations, number 184, is stagnant liver Qi turning into heat. Okay. etiology or yung causes nito, yung states of resentment, frustration, and anger over long periods of time. Tagal nang kinikip-kip yung galit, hindi matanggal-tanggal. So underlying and accompanying pathology, stagnation of liver qi, hyperactive liver yang. Okay? Sign and symptoms, hypochondrial or epigastric distension, feeling of oppression of the chest, irritability, melancholy, yung malungkot, depression, moodiness, premenstrual tension, irregular periods, premenstrual breast distension, plumstone throat, yung parang may bara yung throat, feeling of heat, panay na nainitan, red face, pagkauhaw, tears, easily angered, madaling magalit, and heavy periods. Okay? When you palpate the pulse, it could be wiry and maybe rapid. Okay? When you look at the tongue, you can see red on the sides. Treatment principles, course liver, rectify the qi, resolve depression, harmonize liver and spleen and stomach, and pulse the heat. Okay? Acupuncture treatment, we're going to use the points. PC6 regulates liver qi. Liver 13 harmonizes liver and spleen. Liver 3 forces liver qi. Liver 2, pareho si liver 3 and liver 2, clears heat from the liver. GB34, gallbladder 34 forces liver qi. Liver 14 harmonizes liver and stomach. Triple warmer 6 or Sanjiao 6 clears heat in the three burners. And the bladder 18 versus liver taste. Okay po. Thank you very much. I hope you learn. Thank you po. So,
Thank you very much, Ma'am Nitz. Enjoy your stay in Lukba. Okay. Any questions? Okay, if there are no questions, we will continue with acupuncture patterns and practice. We will continue the discussion of diarrhea last time. Okay, clinical manifestation. Diarrhea may present as increased frequency of defecation. So, madalas yung pagdudumi. It may occur 3 times, 5 times, even more than a dozen times in one day. Feces may be loose or poorly formed or watery, or maybe mostly undigested foods. So meron pong accompanying symptoms of abdominal pain and borborygmus. If the diarrhea is due to attack by cold dampness, tongue coating is white and greasy, and the pulse is soft and even. If due to attack by dampness heat, tongue coating is yellow and greasy, and the pulse is either soft or slippery and rapid. If due to injury naman by intemperate diet, tongue coating is dirty or thick and greasy. If due to spleen insufficiency, pale tongue with white and moist coating, pulse is thread-like and feeble. If due to kidney insufficiency, tongue is pale, thin and white coating, pulse is deep and thread-like. Patients often have a history of eating binges, yung mga malakas, yung mga super parang mukbang, or of eating unclean food or drinks. Diarrhea may occur throughout the year, but is most common in summer and autumn. Key points of analysis. So let's talk about the acuteness and severity. Acute or explosive diarrhea begins abruptly, short lang po yung course, mainly due to strong dampness. Chronic diarrhea, more slowly yung pag-start and has a longer course, persisting for many days, often relapses when the patient indulges in intemperate diet or is excessively fatigued. Chronic diarrhea is mostly due to spleen insufficiency. If prolonged, meron ding kidney insufficiency. So meron tayong pre-dawn diarrhea, which is also called the cockscrow diarrhea, and flank aches. These indicate weakness of the fire of the vital gate and simultaneous illness of the spleen and kidney. In mild diarrhea, appetite and diet are generally normal, good prognosis. Pag meron pong anorexia and emaciation, and the diarrhea is unchecked, or defecation is persistent and uncontrollable, obviously, nadideplete po yung body fluid. So there will be now, this will lead to collapse of yin or yang. Winged heat and deficiency strength or deficiency excess. If illness is acute with epigastric and abdominal distension, abdominal pain with guarding and relief following defecation and difficulty with urination, excess po ito. No? If the course is more prolonged, mild or moderate abdominal pain, alleviated by pressure, nawawala if you apply pressure. Normal ang urination, walang absent and wala pong thirst, no? Illness is deficiency. If the feces are like water and contain undigested food, tapos may abdominal pain, cold aversion, preference for warmth, tapos cold ang hands and feet, so the illness is mostly one of cold. If the feces are yellow-brown, strong foul odor, burning of the anus, explosive urgency to defecate, scant urine, a red, thirst with preference for cold drinks, the illness is due to heat. No? Mixed illnesses naman. If cold intolerance, spontaneous sweating, fever, headache, and a floating pulse accompany the diarrhea, meron din siyang wind. If it comes in high summer or especially hot weather, with fever, thirst, heavy head, spontaneous sweating, and a soft and rapid pulse, meron din pong summer heat. If distension and pressure in the epigastrium and foul eructation accompany the diarrhea, there is injury by intemperate diet as well. So acupuncture treatment, pag violent diarrhea, for cold dampness attacking the spleen, approach is warm the middle jaw and dry the dampness. Select CV12, stomach 25, stomach 36. Liver 13 and bladder 20 are also reserve points, no? Supplementary. Apply the reducing method and moxibustion. For dampness heat enduring the middle jaw, so the approach, we cool the heat, dry the dampness. Select CV12 again, stomach 25, then meron na dagdag stomach 37 and spleen 9. Apply reducing method. Do not moxa. For food retention, okay, approach is promote digestion, relieve retention. Select CV11, CV6, stomach 25, liver 13, bladder 20, stomach 36. Reducing method. Chronic diarrhea, for spleen and stomach insufficiency, so gumagamit na tayo ng mga baksyo dito, no? Approach is to strengthen the spleen and invigorate the middle jaw. Select CV12, liver 13, CV6, stomach 25, bladder 20, and spleen 6. Reinforcing method and moxa. For suppressed vital gate fire, so approach natin, warm and augment the Kidney-Yang. Select GV4, bladder 23, CV8, CV6, CV4, and spleen 6. So, moxa po lahat ang ginagamit sa lahat ng acupoints. Case study, the patient was an adult female who the day before, nagkaroon siya ng acute onset of fever and chills. By evening, nagkaroon na siya ng diarrhea, thin yellow feces. Diarrhea had recurred 7 or 8 times by the time of consultation. Each bout was preceded by abdominal pain, epigastric distress, and nausea. Urine was scant, tongue red with thin and white coating, pulse soft and rapid. Body temperature 39.3 degrees Celsius or 102.7 degrees Fahrenheit. Stool analysis 0 to 2 white blood cells, 0 to 2 red blood cells. So diagnosis, diarrhea due to summer heat and dampness disturbing the interior and aggravated by new exogenous evils in the exterior, leading to disharmony of the spleen and the stomach. Therapeutic principle, release both the interior and the exterior. So medyo madugo yun. We just need to emphasize that diarrhea can have different patterns. Thank you very much for listening. Any question?
Doc, yung diarrhea ganun, pag sa ano po nire-resetahan na ng antibiotic?
Ay, oo. Lahat ng diarrhea. Kaya nangyayari, bumabalik pa rin. So kahit, even if the antibiotics not indicated. Usually naman, nagbibigay ng antibiotics pag may fever. Anyway, so yun, ganun talaga. So ang atin na lang is how to remove the side effects, no? And the acupuncture and moxa can definitely help. Thank you. Any other comments? Okay, kung walang comments, diretso po tayo sa signs and symptoms. This time, we listen to Ma'am Teresita, who is so excited to go to Baguio, o diba? Teresita.
Yes po, Doc. Good afternoon ulit at sa lahat na po. Signs and symptoms of pale gums, red gums, and purple gums. In Spleen-Qi deficiency, signs and symptoms are pale gums, pale lips, poor appetite, tiredness, slight abdominal distension, pale complexion, loose stools, pale tongue, and empty pulse. In blood deficiency, signs and symptoms are dull pale gums, tiredness, dizziness, blurred vision, scanty periods, pale tongue, choppy or weak pulse. In Spleen-Yang deficiency with empty cold, signs and symptoms are bright pale gums, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, feeling cold, cold limbs, edema, pale and wet tongue, and has deep, weak pulse. Next is red gums. In stomach heat, signs and symptoms are bright red gums, swollen gums, bleeding gums, thirst, foul breath, burning epigastric pain, sour regurgitation, nausea, excessive hunger, a feeling of heat, red tongue with a yellow coating, and overflowing rapid pulse. In Yin deficiency with empty heat, signs and symptoms are red gums, bleeding gums, feeling of heat in the afternoon, dry mouth and throat, especially in the afternoon, thirst with a desire to drink in small sips, dull or burning epigastric pain, feeling of heat in the afternoon, constipation with dry stools, feeling of hunger but no desire to eat, slight feeling of fullness after eating, night sweating, 5-palm heat, red tongue or red center only without coating in the center, and has floating, empty, and rapid pulse. In spleen heat, signs and symptoms are red gums, dry and red lips, burning epigastric and or abdominal pain, excessive hunger, red tip of the nose, mouth ulcers, thirst, dry stools, a feeling of heat, scanty dark urine, yellow complexion, red tongue with dry yellow coating, and overflowing rapid pulse. In spleen empty heat, signs and symptoms are pale red gums, poor appetite, poor digestion, retching, gnawing hunger, loss of taste, slight epigastric pain, dry mouth and lips, dry stools, thin body, sallow complexion with red tip of the nose, night sweating, a feeling of heat in the evening, malar flush, red tongue without coating, and transversal cracks on the sides with floating, empty, and rapid pulse. Next is purple gums. In blood stasis, In the stomach, signs and symptoms are purple gums, bleeding gums, toothache, purple lips, severe stabbing epigastric pain that may be worse at night, dislike of pressure, nausea, vomiting, possibly vomiting of blood, vomiting of food in the form of that looks like coffee grounds, and has purple tongue with wiry pulse. In heat at the blood level in febrile diseases, signs and symptoms are purple gums, bleeding gums, dark macular rash, mental confusion, fever at night, high fever, irritability, vomiting of blood, epistaxis, blood in stools, blood in urine, dark red tongue without coating, and has fine, wiry, rapid pulse. Yan lang po. Thank you so much for listening.
Yeah, thank you very much. Ito lang medyo interesting po. Pag blood stasis in the stomach, most likely it could be stomach cancer. No? So, medyo meron na po akong case ganyan. Okay, nagpaalam na rin.
Sayang hindi ko picturean yung kaibigan ko sa Zamboanga na may stomach cancer. Hindi ko na picturean yung tongue niya.
Sige, maghanap tayo ng mga... So,
Karaniwan daw pag may cancer, may mga ano na black na po yung tongue niya eh.
Oo.
Meron
Kasi
pong mga dot na black.
alam nyo, it is very important that we look at the tongue, especially yung underside, yung ating mga sublingual veins. Before kasi mag-purple ang tongue, nagdi-distend po siya, no? Nagiging swollen. So yung pa lang dapat red flag na. Yun. So pag early signs, nakikita na. So do not forget to always look at the sublingual veins. Okay. So yun. Pagsikapin talaga natin na hindi siya distended. Okay? Thank you very much, Ma'am Teresita. So we will now proceed po sa ating last but not the least topic. This is actually the last topic for asthma. And we have Ma'am Vina Pasqua of Baguio to do the presentation. Good afternoon po ulit, Ma'am Vina.
Good afternoon po ulit, Doctor. At good afternoon po sa lahat. Asthma, Western drug therapy. Because most asthmatic patients whom we treat are bound to be on some kind of medication. So, importante po na maintindihan natin the medication's mode of action and how they affect our treatment. Ang four main approaches to drug treatment of asthma in Western medicines are number 1, oral or inhaled corticosteroids. 2, bronchodilators, agonist or anticholinergics. Number 3, anti-allergic drugs. Number 4, leukotriene antagonist. Each of these drugs acts as a certain stage of the pathological process that leads to asthma. Corticosteroids. These act by reducing bronchial mucosal inflammation and hypersecretion of mucus. Inhaled corticosteroids are for the most commonly used. Ito yung palaging ginagamit ng treatment of asthma. Pag yung symptom remain uncontrolled, then oral administration is preferred. When given orally, they produce many more side effects. From a Chinese perspective, itong drugs na ito produce heat and pinapahina niya po yung kidneys. They definitely affect the tongue, making it red at saka swollen. They also affect the pulse as the kidney positions become weak and the pulse is generally more rapid than normal. Although they can be combined with acupuncture and herbal therapy, corticosteroids slow down the effects of our treatment somewhat. In the course of our treatment, importante po na itonify po yung kidneys even more by using points such as bladder 23 and herbs such as Chu Di Huang and Xing Di Huang. Yan po yung herbal. The mode and site of action of the above three drugs may be summarized in two diagrams. One, allergen, mast cells, chromoglycate. Sa mast cells po, histamine at saka bronchospasm. Ang ginagamit ay salbutamol. Incomplete clearing of mucous inflammation. Ito yung corticosteroids. Dito naman, nakikita yung allergens, mast cells, eosinophils, mediator and cytokines release, inflammation, bronchospasm, tissue swelling, at saka airway mucus. Yan po. From the point of view of Chinese diagnosis, selective bronchodilators such as salbutamol, ito yung Ventolin, do not affect the tongue, although they make the heart pulse slightly overflowing. Other bronchodilators such as isoprene and orsiprenalin have more side effects on the heart, and besides making the heart pulse overflowing, they also make the tip of the tongue red. Yung paggamit po ng bronchodilator inhalers may be integrated with acupuncture and herbal therapy. Indeed, they may provide a useful benchmark of the efficacy of our treatment as the patient gradually reduces the frequency yung paggamit po ng inhalers. The most common brands of this type of drug is salmeterol and albuterol. So yan po. Anti-allergic drugs, mast cell stabilizers. These act by stabilizing the mast cells in the bronchi and reducing their sensitivity to allergen stimulation. Ginagamit po ito only as a prophylactic in the sensitivity to allergen prevention and not the treatment of asthma. They seem to be more effective in children than in adults. They do not affect the treatment with acupuncture or herbs and do not produce any appreciable change in their pulse o kaya sa dila. The most common brand names of this class of drug is in the USA and UK are Primoline inhaler and Nidocromil oral inhalation. Yan po ang name niya. Leukotriene antagonist. Inflammatory molecules called leukotrienes are one of several substances that are released by mast cells during an asthma attack. And it is leukotrienes that are primarily responsible for the bronchoconstriction. A new class of anti-asthma drugs has been designed to interfere with the activity of leukotrienes. Both leukotriene synthesis inhibitors and cysteine leukotriene receptor antagonists have recently been shown to protect asthmatic patients against asthma attack. But they are not useful as rescue remedies once an attack has already started. Itong mga drugs na ito act by preventing leukotriene release from mast cells or by blocking the specific leukotriene receptors on bronchial tissues. Thus, nagpre-prevent po ng bronchoconstriction, mucus secretion, and edema. These drugs also reduce the influx of eosinophils, thus limiting inflammatory damage in the airways. These oral non-steroidal anti-inflammatory drugs reduce the incidence of acute asthma attacks when taken regularly. Ang most common brand na pangalan nito of this class of drug in both the UK and USA are Montelukast, singular, and Zafir Lucas po, accolade. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Okay, meron lang pong red flag na, na dapat natin tandaan. In a patient receiving continuous treatment for allergic asthma, meron pong mga cyanosis, increased respiratory rate, shallow breathing, agitation, and wheezing. They may represent acute respiratory failure. So dapat nire-refer na po natin. Okay? Maraming salamat po, Ma'am Vina. And thank you, everyone. Do we have any questions before we take a break? Then we meet again at 8 p.m. tonight for our group study. So if there are no questions, thank you everyone for joining and see you again tomorrow. Good afternoon po.
O baka nawala na tayo. Hello, Ma'am Tess.